हेलो एवरीवन। हम लोग साइकोलॉजी के क्वेश्चन आंसर्स की बात कर रहे हैं इस वीडियो में। और ये चैप्टर है साइकोलॉजिकल डिसऑर्डर। फिजिशियन मेक डायग्नोसिस लुकिंग एट पर्सन's फिजिकल सिम्टम्स। हाउ आर साइकोलॉजिकल डिसऑर्डर्स डायग्नोस्ड? Psychological disorders are diagnosed on the basis of two classifications, DSM or DSM-4 और ICD-10। ओके, अब DSM-4 यहाँ पे मेंशन है, अब DSM-5 भी आ चुका है। ठीक है, क्लासिफिकेशन ऑफ साइकोलॉजिकल डिसऑर्डर कंसिस्ट ऑफ अ लिस्ट ऑफ कैटेगरीज ऑफ स्पेसिफिक साइकोलॉजिकल disorders grouped into various classes on the basis of some shared characteristics. International classification of disease. ICD-10 is a classification of behavioral and mental disorder. ICD-10 refers to International Classification of Disease and its 10th revision is being used. It is developed by WHO under one board heading mental disorder, which is based on symptoms. The classification scheme is officially used in India. The American Psychiatric Association (APA) has published an official manual of psychological disorders. The Diagnostic and Statistical Manual of Mental Disorder, 4th edition, DSM 4th. It evaluates the patients of 5 axes on dimensions rather than just one board aspect of mental disorder. These dimensions relate to biological, psychological, social, and other aspects. Uses of classifications. Classifications are useful because they enable psychologists, psychiatrists, and social workers to communicate with each other about the disorders, help in understanding the cause of psychological disorder and the process involved in their development. It helps in clinical diagnosis. Question number 6. Distinguish between obsession and compulsion. Sometimes anxiety and tension are associated with obsession. Persistent, unwanted thoughts, impulses, or ideas are compulsion. Seemingly irrational behaviors repeatedly carried out in a fixed, repetitive way. People with obsessive compulsive disorder find their obsession or compulsion distressing and deliberating but feel unable to stop them. The compulsive actions are usually carried on to alleviate the anxiety caused by obsession. A person provoked with anxious thoughts may try to block them out by compulsively counting steps while walking. Another person obsessed with the idea that he guilty or dirty may wash his hands every few minutes, sometimes till the bleed. The symptom of OCD includes contaminations, an obsession of contamination followed by washing or compulsive avoidance of the object. Same and disgust and the feeling of being easily contaminated are common. Patients usually believe that the contamination is spread from the object to object or person to person by the slightest context. Pathological doubt. Obsession of doubt followed by the compulsion of checking. Patients have an obsessional self-doubt and are always feeling guilty about having forgotten something. The checking may involve multiple trips back to the house of to check the stove, intrusive thought, repetitive thought of a sexual or aggressive act that is reprehensible to the patient. This is usually not followed by the compulsion. Symmetry. He needs for symmetry and precision, which can lead to a compulsion of symmetry, a compulsion of slowness. Patient can literally take an hour to shave their faces or eat a meal. Other symptoms patterns may include religions, obsession and compulsion, hoardings, and well as trichotillomania, compulsive hair pulling and nail biting. Can a long standing pattern of deviations behavior be considered abnormal? Abnormal behavior is a relative term. It is matter of degree. It is qualitative difference. There is no quantitative difference between normal and abnormal. The word abnormal literally means away from the normal. It implies deviation from some clearly defined norms or standards. Whereas view to explain abnormality. Abnormality as deviation from social norms. Each society has social norms which are stated or unstated rules for proper conduct, behavior, thoughts, and emotions that break societal norms are called abnormal. Behavior violates social norms or threatens or make anxious those observing it. Violation of norms makes abnormality a relative concept. Various forms of unusual behavior can be tolerated depending on the prevailing cultural norm. Yet this component is also at once too broad and too narrow. A society values may change over time. Serious questions have been raised about this definition. It is based on the assumption that socially accepted behavior is not abnormal and that normality is nothing more than conformity to social norms. This approach has measured shortcomings and there are serious questions against these approaches. Abnormality in terms of maladaptive behavior. Recent approaches view abnormal behavior as maladaptive. Many psychologists believe that the best criterion for determining the normality of behavior is not whether society accepts it, but whether it facilitates the well-being of the individual and eventually of the group to which he/she belongs. Well-being is not simply maintenance and survival but also includes growth and fulfillment. Maladaptive behavior refers to behavior that causes problem in life. It is inadequate reactions to the stressful situation. It ranges from relatively minor but troubling fears to severe distortions of reality. Concept of 4Ds. Nowadays, many psychologists believe in that in an individual if an individual's behavior manifests significant deviance, distress, danger, dysfunction in his/her behavior pattern, then it should be treated as abnormal. Thank you.